The secret to instant relief for sciatica symptoms is to pay attention to the relationship between the body positions and the leg pain, because if we have less leg pain, we have therefore less irritation on the nerve. So we want to adopt positions that reduce that irritation. In a moment, I'm going to show you 3 really effective positions that I've known over the years of my 25 years of experience of treating sciatica to be effective to help reduce your symptoms. Now, it's important that you realise that not all the positions may be appropriate for you, depending on the cause of your sciatica, which can be, of course, from lots of different causes. One position might be really effective for you, but another one might increase your leg symptoms. So only do the one that reduces your leg symptoms if it does. Now, when it comes to sitting, quite straightforward really. You just sit down, do the leg symptoms get any better? Well, we need to be a little bit more precise than that, because you can sit in lots of different ways. Now, generally, if you've got a disc problem that's causing your leg symptoms, your sciatica symptoms, sitting doesn't tend to be very comfortable. However, if you have a stenotic problem because of degeneration of your spine, and so your back is generally stiff, then actually sitting tends to be a comfortable position. So it varies between people about whether this sitting position is going to be effective. What we should do is sit down in a relatively upright chair. We should experiment to see whether the positions where we're sitting make a difference to our leg symptoms. So what we're going to do to begin with is sit down on a chair, and we're going to slump back into the chair. We're going to slouch into the chair to see if that is more or less comfortable on our leg symptoms. Now, depending on the cause of it, it may be one or the other. After assessing that, we're now going to do the opposite and sit bolt upright and try to arch our back as much as we possibly can to see if that is comfortable on our leg symptoms. And is there one or the other which is more or less comfortable? Now, if you find that you are more comfortable with a sitting up position, then you should adopt that position and perhaps put a cushion behind your back. But if you find you're better sitting in a slouch position, you actually may be better sitting in a comfy chair, which you can sink back into, which can then open up the joints of your back and relieve some of the pressure on the nerve. It purely depends on which effect reduces the leg symptoms, which movement reduces the leg symptoms. And you might find neither of those two actually reduce your leg symptoms, and that sitting is generally uncomfortable, in which case you should move on to the next one, which is our second position. Now, a great position to adopt, particularly if you didn't get on with the sitting position, is a prone lying position, leaning on our elbows. So we're going to lie on our front comfortably and just lean onto our elbows so that our back is slightly arched up, and we are going to hold that position. Now, again, we are assessing for comfort in terms of the leg, also of course in terms of the back, because we are arching our back in this position, and so if you go too far, that can sometimes be a bit pinchy around your back and be uncomfortable. But if it's comfortable, you'll know, because you'll lie on your front, you just lean up onto those elbows and you'll feel the leg sensations, the pain in your leg reduce very, very quickly. So adopt that position if you find that is a comfortable position for you. Now, on to our third position, which is lying on your back with your legs supported on a chair. So what we're going to do is lie down, have a chair, pop our legs up onto that chair, and we're going to just rest in that position. And this is a nice way to unload the spine, to open up the structure of the spine without too much pressure going through it. And again, assessing how the leg symptoms are in this position. Does it change it at all? And we certainly won't want to straighten our leg out. We want to keep our leg bent, because a straight leg stretches the nerve and a bent leg reduces the pressure and tension on the nerve. So with our knees bent, we're going to rest in this position. We can change the angle of our legs, so further away or perhaps closer to see if that makes a difference in our leg symptoms. But basically, this is the position to try and see if it reduces your symptoms. Now, as promised, here's a screenshot of some of those things that I just talked about, with a recommendation of how long to adopt them for and how often during the day. So I hope that was useful to you, and if you're looking for some other positions, perhaps you'd like to try this other video I did about reducing the pressure on the nerve.